I am Mara Gordon. I am a family physician and writer. And it is such an exciting opportunity to get to interview my old friend and colleague, Dr. Jennifer Reid, who I have to say I've known for years. Actually, you were my teacher when I was in residency. You taught me all about mental health for the primary care doctor. So it's so cool that we've stayed in touch over the years, and we're both writers now too, which is really amazing. So it's wonderful to get to have the chance to talk about your fabulous new book, which is very, very top of mind this time of year. So Dr. Reid, Jennifer, do you want to just introduce your book and talk about what made you want to write it, and then we'll get into some holiday guilt, which I know is on my mind.
On
But yeah,
everyone.
tell us about what made you, as a practicing psychiatrist, want to write a book about guilt.
Mhm. Yeah, I think it really when you're sitting across from patients as you've experienced, right, you start to pick up these different themes that are coming through or just ideas that are repeated or questions that come up again and again or challenges people have. And I heard from so many women that they were feeling just like constantly this sense of I'm like not doing enough. I'm not quite getting it right. I'm falling behind. I'm overwhelmed and I'm working so hard, but I'm still not like succeeding. And I think really just thinking about that as guilt, I was trying to, help them obviously come up with some different ideas or strategies. And I just felt a little bit ill prepared. I couldn't find resources. I wasn't quite sure how to really simplify it because I like to really break things down so that we can start seeing it kind of objectively, right? Because it's right up in our face and really thinking about how do I want to break down guilt and then how to just put all the strategies that I've seen be helpful for patients over the years into the book itself. So I could just say, start here, like take a look at this book when you have some time, and then we'll talk about it in session. And so it sort of was prompted by that. Like, I want to have a resource to give to my patients and honestly to my friends and my sister and to read myself over and
Yeah.
over again because guilt affects all of us, but I think women in particular are just really struggling with a lot of guilt.
Well, it really feels top of mind in December, and there is something about the holidays and our sort of cultural ideas as Americans about what this time of year means that is just like a guilt fest. Like, I know that I have been feeling really guilty in a lot of different ways over the last couple of weeks, and reading your book has given me some places to evaluate where those feelings are coming from, and we can get into that. But yeah, what is it about December that's just like guilt-o-rama?
It really is. And, I have to
Yeah.
say, like, I'm not immune to guilt. It's not like suddenly I've written the book and I never feel guilt. But now it's sort of like, again, where is it coming from? Can I start to evaluate and be able to push back on it and
Well,
not let it
and
make
guilt
my
can be
decision?
good.
Right.
And it can be
Right.
good. We'll talk about that too. It can be a positive emotion, which I think is a really nuanced point that you make. But yeah, let's talk about the holidays. Like, what is going on? What are your what yeah, what's going on?
Yeah. Well, I think it's sort of where I hear a lot of guilt, I mean, men and women, this is not just for women, but this idea in particular in really happy moments or things that we expect that we're going to feel a certain way, which is, maybe a wedding or a new baby or the holidays or something that's really positive, a promotion at work. And we're kind of surprised by the ambivalence we may feel, which is that there are parts of it that are really hard. Maybe there are parts of that change that we really miss the old version of me, or maybe we really miss like I don't know, September when we didn't have to worry about gifts and planning and meals and making sure everyone feels a certain way, which we could talk a bit more about because, we can't really control that. And so I think there's a lot of guilt around the sense of I should be feeling a certain way. I should be making sure others are feeling a certain way around this joyful time. And I think that can put so much pressure and these expectations, which as we'll talk about are such a huge part of guilt can really explode then. And piled on top of that are family traditions and cultural traditions and maybe what we're comparing ourselves to on social media. And it just can all come together and I think really crush us with guilt.
Totally. And not to mention, consumer driven expectations. I mean, so much of like our cultural conception of the holidays is like created by big companies that want our money, right? And they have a lot of power and a lot of influence, and it's sort of this idea of what the holidays are supposed to be, and then you're talking about that expectation falling short, right? And
Mhm.
it's impossible to meet a standard created by Hallmark, right? I mean, it literally doesn't exist. So that's part of your definition of guilt.
Mhm.
Will you talk a little bit about that?
Yeah. So I just, again, I wanted to find the absolute simplest way, which I've created the guilt equation. I really enjoy math. Like I like that there's an answer to a question, you know? And so my guilt equation is essentially the guilt is the difference between our expectations of ourselves, which are
Mm,
created by many things, the difference between that and how well we feel like we're meeting them. Like, what are we seeing ourselves doing to meet those expectations? And so it's really important that that is our perceived sense of reality. We're saying, okay, this was my expectation of what I wanted to have for this holiday event. This is what I was able to do. But I think so often we really minimize or we underestimate the amount of really positive, engaged, hardworking things that we do. And we set our expectations so high, not because we are getting it wrong, but because we exist. We're swimming in this sea, of expectations set on us by our socialization from a very young age, for example, that we as women should take care of everyone in all
mm,
settings. It even happens at work, right? You're in this caring profession, and there can still be this pressure for the women within the office setting or in the, resident or attending setting in the hospital to be the one to do the caretaking, like check in on that, resident, make sure they're doing okay. Or could you just plan like a little birthday celebration for one of the nurses? It's her birthday, or these kinds of things. I think that pressure is something that starts when we're really young. The sense of like, oh, Sally, your mom seems really sad. Maybe you should try and like cheer her up, or you should just do what she wants you to do so that she'll feel better. And I think over time, women can really get so caught in those expectations. But I really wanted the book to not feel like it was blaming women for these expectations they hold, because it's not something we're just coming up with out of the blue. If we were, we wouldn't all be having such similar experiences, right?
hmm. But are those expectations, like, always negative? Like, the idea of showing care to our colleagues, throwing birthday parties sounds really nice, right? When in a workplace that can feel sometimes kind of dehumanizing, depersonalizing. I don't know. My clinical office is actually mostly women. We have one man who works in our office, and we are just a giant love fest. And I mean, it's interesting. One of my colleagues has really sort of taken upon herself. She's a physician, a woman, to be like the cake woman. And she said she grew up poor. She never got to have cake for her birthday as a child, and that she just like loves cake, and she wants to celebrate birthdays. And I mean, I certainly, from my perspective, the fact that she goes out and buys like a nice cake for, 12, 13 people's birthdays, that's, 13 times a year, seems like I don't know if unreasonable expectation, but it is a high expectation, right? That she's sort of set for herself. But like, it's also really lovely. Like, did those expectations ever play a positive role for people?
Yeah, I love that you're describing your clinical setting as a love fest.
Yeah.
I wish we had more of those
Yeah, it is. It's really
nationwide.
great. Yeah.
That's awesome.
Yeah.
I think certainly not, all expectations are not bad, but I think this sense of I should, like in order to be sort of reach almost perfection, to be a perfect example of a family medicine physician or a mother or a friend or daughter, I need to meet these all of these expectations and I should do that, right? And I think it's when those sort of shoulds come up, there's this sense of I'm not doing it because like your colleague, it gives me pleasure because it's something I didn't have growing up and I want to make sure I'm sharing that with others. That's different than saying, oh, okay, I got this email that as parents, we're supposed to all make cookies to send into school. And if I just like buy some and send them, people are going to think I'm a mom who doesn't like care enough to take the time, this kind of thing. Right. And so I think that's where there are differences. But as you brought up earlier, I do want to touch on just where guilt can be adaptive because we
Yeah.
evolved over eons to experience guilt. And so when I looked into it, it was like, well, why, why do we have to have this
Yeah.
emotion?
Totally. That's such a
And,
good question. Yeah.
in part, it's about how did we come together as communities, as collaborators? And guilt was actually an important way for us to say, oh, I think I've done something wrong and it's harmed you in some way. And I feel guilty, which doesn't feel good, as we know. And therefore, I want to try and repair. I want to try and say, I want to apologize. I want to try and make it better. I want to not do that again next time. And so, not only does it help you behave differently going forward, it helps that other person that you're trying to stay in touch and communicate with and collaborate with. It helps them see that you care and that brings you together. Right. So if we have no guilt, if we were absolutely free of guilt, I mean, guilt free as a book is really how do we get rid of this toxic kind of
Mhm.
generalized guilt? But of course, if we never felt guilty about anything, we'd be, a toddler who hasn't quite learned. We learn maybe age 3 or 4, hasn't quite learned. So I think that can be really important to differentiate. The guilt I'm talking about, though, is this maladaptive guilt that's generalized, that it's applied across the board, and there's no way to reach this elusive enough, right?
Hmm. Yeah, and that's so interesting, and I wanna distinguish, like, in your book, I think you very clearly demarcate between toxic guilt and sort of adaptive guilt, and we actually have a question from somebody who's watching, thank you, LFH, who's saying we could use more guilt in many cases, and they're curious about the overlap between sort of empathy and accountability. And maybe if it's okay, I'll share an anecdote from your book, which I really liked because I think it helped clarify in my own mind. And then you can obviously expand on it. But you share the story of, an older woman who is living in a senior community and really is feeling lonely and wants her. Hi, Leah. What's her oh, I think we might know Leah. Hi, Leah. And a friend of the pod, as they say. Yeah, so they this older woman really wants more social connection, wants to see her daughter more often, but sort of relies on guilt and guilt tripping the daughter to achieve what she wants, right? And you break down how like clear communication about um, like, sort of explaining her needs, explaining her emotional state, sort of being honest with herself and with her daughter about what's going on is really different from that sort of guilt sensation, which can feel really sort of sticky and unpleasant. So I thought that was so great. That really clarified for me. Do you have other examples you can share, Jennifer, that sort of can help us think about like when guilt is helpful and is about empathy and about accountability and when guilt is this sort of toxic guilt.
Right, absolutely. I mean, that's a great, great question to clarify that because when we think about different types of maladaptive guilt, this kind of manipulative guilt actually has its origin in one of the more beneficial over the years aspects of guilt, which is that it actually helps someone in a position of lesser power influence and maybe
Right.
change something in those who have more power. It's just when it starts to be used in all these different settings or in a way that really feels like it's so manipulative, right? When we're kind of talking in extremes
Mm,
here, then it really can have the opposite effect. So in that situation, the woman, I think Carolyn was her name, in using that guilt, she actually pushes her daughter away because there's a sense of, oh, I wish you could be here more often, but I know it's really hard for you. And then her daughter feels badly about this. And so kind of pulls back because she's sort of like ashamed that she's not participating, or it just feels so negative to have someone fill you with guilt. And so you start to kind of pull away, which is the opposite in this
right, so it's
situation in the
it's
film.
ineffective too.
Right.
Yeah. Are there other examples that come to mind, either from your book that you wanna share or from your own life or from clinical practice, where you can sort of distinguish between the 2?
Right. Yeah, absolutely. So I think that, I mean, the really interesting thing, and I recognize that it is a generalization, and that's, it's in the book, but that in my conversations with men and women, there really has been a difference in this belief or this sense about what guilt, how often guilt is happening. What is the
Mm,
experience of guilt? And it's interesting because a woman, if I tell them, I speaking to a woman about the book and I say, hey, this is what I'm writing about, they're like, oh, yes, okay, I see what you're saying. And really many of the men I've talked to, including my family members and friends, have said, like, about what? Like, what is the guilt? What specifically is the guilt about? And I think it's that difference that, men don't seem as often, again, don't want to overgeneralize, but in my experience, don't seem as often to have this kind of overarching
mm.
constant sense of guilt. Maybe if they do something wrong, they may feel guilty, again, ideally in an adaptive sense. But for women, it's just like going into overdrive. And yes, we are often very empathic people. And so we can experience even what someone else is feeling. So if your child is feeling really sad and you're feeling sad and you just feel like I should be able to fix this, you're feeling so, so guilty. But there's a difference between sitting with that child and talking about it or actually taking that guilt and saying to him, you shouldn't feel so sad. You should actually feel better about this. We just got you this new X, Y, or Z, or we're taking you out for dinner, so you should feel better. Because that's actually taking that guilt and using it sort of to manipulate another person. And then guess what? Like your children are going to say, that feels awful. And as they grow and become more independent, that can really interfere with closeness, which I think so many of us want to maintain, obviously.
Right, so it's returning to these ideas, that yeah, what I'm hearing is that guilt, um, uh, can be sort of ineffective at achieving those goals of empathy that you want, right? Achieving that accountability, but also that it can really harm relationships over time when instead what we need is sort of more clear communication about what our emotional needs are, which it's easier said than done. It's hard. It's a tall order. That's why psychiatrists are still in business after many, many years. But I think it's like it's worthwhile to distinguish between those two.
Mhm.
One thing that immediately came to mind when you told me that you were working on a book about guilt was sort of the difference between guilt and shame, which I think is really interesting. How do you think about those two emotions differently?
Yeah, I think if, in a broad sense, I really think about guilt as I've sort of done something wrong. I've committed some sort of, problem or harm to someone else or to myself maybe, and I've done something wrong. And therefore I feel like I need to do something different, work harder, not do that again. Shame can really feel more broad in a sense of like, I am wrong, I am bad. I, as an entire person, not just this action I took or failed to take, but that I, as an entire person, am bad or faulty in some way. And I think sometimes it can be hard when you're looking at a very specific situation. But the really important difference between the two is, like I said, guilt kind of motivates us to try to repair. And often when women are feeling this broad generalized guilt, they just try to work harder and harder and harder to not feel it anymore. Shame has actually been compared in some really interesting research I saw to this kind of fight or flight mechanism, which is that when you feel it, you just react and you want to kind of get away from the situation. You want to hide, you want to withdraw, you want to just not feel that way because it feels awful. And so it pulls you away from people. And so I think that's where there's a big difference is that, gosh, when shame is evoked, if you're in a discussion with a partner, for example, and there's some sense of you're shaming them for who they are, and they can just pull completely back and shut down all discourse. So, to be shameless obviously is not a good thing, but we're talking about the sense of like how negative and toxic shame can be. And it really is rarely adaptive to have that feeling because it doesn't necessarily bring you together. Right.
Hmm. Yeah. Well, I think that's a good segue to talk about something that I write a lot about, which is body image, and particularly how we think about body shame in medicalized settings, which I think is rampant, right? I think clinicians are really to mix my metaphors here. Clinicians are very guilty of using body shame as a maladaptive clinical technique, which I can say is universally ineffective at helping our patients achieve their goals. And I'm curious how you think about guilt, how you think about shame as they intersect with body image, and how those two issues are different.
Mhm. Yeah, so I think, talking about like the guilt equation, this idea that these are expectations that we're experiencing, I sort of categorize them into four different types of expectations or broad categories that I hear from so many women. And these are that constant caretaking that I mentioned, and this
Mhm.
hyper accountability, the sense that I can and should control other people's emotional experiences. And then the other two are sort of this striving for perfection or this idea that we must be perfect to be loved, to be valued, to be important, to be human. And then finally, this idea of balancing it all. And that gets into how do I make sure I'm getting it all done and also appear to be totally balanced. And I think it's that third one, this idea of perfection that comes up so much around our body image and this idea of self control that women are really rewarded for it. There's this sense that, a perfect woman is able to control herself in all these different areas. How much she eats, what her body looks like, how much she drinks, how emotional she is, right? Like, how is she interacting with others? How is she spending her time? And I think that it gets into this sense that can shift into shame around body images that I'm not right. I'm not enough. I'm not lovable. Like, it can get into these really deep core sense of us as an entire person, as if, and the medical industry is certainly guilty of this, but that our BMI defines who we are, or even just that our BMI defines our health, which you and I both know is a fallacy, but one that was really clearly stated in my experience in medical school and beyond.
Yeah. Are there any cases where guilt is adaptive, you think, when we think about our sort of embodied lives and our experience of our bodies, and how we think about appreciating our bodies or showing love towards our bodies?
It's interesting because I think when I've been able to help people move away from guilt about their bodies, that they should be working harder, doing more, or controlling themselves better, there actually can be this sense of guilt that I've been so hard on myself. Like, I've been really beating
Mhm.
myself up for years and years and years. And I think it's guilt of like, why did I treat myself so poorly? Mixed with grief. Like, how did I miss all of these years of opportunity to kind of see me as I am and all these really positive aspects of things? Or maybe they become medically ill and there's a sense of guilt that, like, I didn't appreciate all the parts of my body that were
Mhm.
healthy and working properly and helping me move around the world and carry my brain around to experience life. So I think that those are difficult emotions, but I also think they're important for us to recognize and start to process and really think about, because that's us moving forward. That's us saying, yes, I can feel guilty that I treated myself poorly before and grieving that lost time. But now I can start to repair. And in repairing, it's almost like my voice to myself can be something that's kinder and more compassionate.
Yeah, like if guilt is that sort of gap between expectations and reality, I think what you're saying is that maybe as our conceptions of our own body image start to shift, which I think is, um, for many of my patients has been really positively influenced by the body positivity movement, body acceptance movements. And, I have lots of patients coming in asking about these issues, asking like, what does it look like for me to be kind to my body? Um, and I think what you're saying is that those expectations have shifted, right? And so somebody might experience guilt because they now have different expectations, which is sort of body kindness or body, uh, but gentleness towards one's body. And there's still a gap between that because we've been socialized for our whole lives not to feel that way, but maybe that the expectations are shifting, and so that's where guilt comes in, and maybe it's not a great feeling, but that it's evidence of progress, like you said, right? That's pretty
Yeah.
cool. Yeah.
It is,
Yeah, that's
absolutely it is. And
interesting.
then the flip side, though, that's a little tricky is that and I think you've written about this in an essay where there's a sense of, I should now be fully embracing my
Totally.
body
Totally.
100%, right? Like 100% body love at all times. And if I'm not, I'm failing myself, I'm failing the movement, I'm failing, all these different pressures that we put. So I think it can kind of go in that direction as well. And so the idea around compassion and self-compassion, and you're really thoughtful writing about, how do I talk to my patients about their bodies in a way that really feels supportive and helps to kind of reach their goals? What are their goals? Like, you've
Right.
talked about someone whose goal is to play with their grandchildren and be able to move around a bit more, and that's the important goal for changing or making weight changes, is they want to be able to have a fuller life as a grandparent, for example.
Totally, right. So it's about clarifying those expectations, clarifying the reality, and clarifying the gap between the 2. Yeah, I really like that way of putting it. Well, you have, in your book, you have some very practical tools, and I'd love to briefly talk about the step-by-step, like, SPEAK, SPEAK suggestions you have. Can you talk a little bit about what that is?
Yeah. So when I'm reading some of these different books, I get to the end sometimes and I'm like, okay, like great, this sounds
What
great.
do I
Like I
do?
want to make a
Tell me
change.
tell me what to do, totally.
Yeah.
Yeah.
And, I think in working with my terrific editor, she really kind of emphasized that too and was like, how do we make this absolutely crystal clear? And so I created Speak because it was just a step by step way that I sort of use in any psychotherapy practice when I'm working with somebody. And it's pretty simple. It's like S is show up. So it's literally like jump on this call, check out the book, listen to a podcast, these kinds of things. Like just show up because it's so important because you're telling yourself I matter enough to take the time to do this,
Mhm.
which is an important message, right? And then pay attention. The P is for pay attention. And that's just sometimes we don't even notice until we kind of look inward. What are the thoughts that are coming up, right? Like as I'm getting up this morning and I'm thinking, okay, what do I have to do before the holiday? And I can't believe I haven't gotten that done. I'm so lazy, or et cetera, right?
Mhm.
But when we really have to start to tune in and pay attention to our thoughts and feelings so we can get a sense of what are we saying to ourselves, right? And E is examine. That's just digging in a bit more. Where am I feeling the most guilt? What are some of the triggers for guilt? Do I hang up a phone call with a friend and really feel terribly guilty? Does that happen with a family member? Does it happen at work? Where is this coming up? And so I can start to understand it. A is my favorite is take action because again, it's like, what do we do next? And that's about how do we shift these two variables? How do we challenge the expectations that we have for ourselves that may not be serving us anymore? A perfect mom never has a sad kid. Okay. Right. A perfect,
LOL. Yeah.
yeah, a perfect
Yeah.
doctor, like, never has a day at the office where they feel like they just have failed everything. So,
Right.
that I forget to do a lab order or I forget to call someone back, like a perfect, et cetera, et cetera. So it's how do we reshape our expectations based on what our values, not what's been told to us, taught to us, given to us, pushed onto us. And then on the flip side, how do we actually nurture our awareness of the things that we're already doing and that we're doing well. And even sometimes, like around the holidays, this actually may mean that we start to do less because we're noticing I'm just hyper functioning right now because I'm trying to get rid of this guilt that I can't control other people's feelings and make sure they have the very best holiday ever. So I'm just spitting out with all these different activities. And when you're paying attention to what you're actually doing, it might actually mean you say, you know what, I'm going to pull way back on the menu. I'm going to maybe buy fewer gifts, or I'm just going to really focus in on these specific traditions that are meaningful to me. And I'm also going to think about how do I want to feel during the holidays? And if I want other people to empathize with that feeling, what would it be? And for me, it's like relaxed, just maybe a little bit silly, connected, cozy. These are the things I want to evoke. How do I work backward from that to figure out how to actually move forward and engage in a holiday? It's not a perfect system, but I think it's just something that we're going to be keeping in mind, and that's where some of those strategies are. And then finally, K is just keep going over and over and over again because
Yeah.
it's a practice, right? Just like anything, exercise, the way you're eating, your relationships, medicine, those are all a practice.
Totally, right? So I think what I'm hearing over and over again is that, if guilt is sort of this gap between, expectations and reality or sort of the reality of our emotions, that it's about sort of, um, reframing expectations at times, right? And taking a really thoughtful look at what those expectations are and then being honest with ourselves about how to sort of align our internal experience with those expectations. Do you think any I wanna get back to this idea about positive sources of guilt and sort of tease out more about what you consider like a toxic sense of guilt from, uh, guilt as a sort of evolutionary and cultural tool to help us be accountable. Because I think that is really powerful. I think there's, like, a lot of self-help speak on the internet that, I'm sure you think about a lot that's just sort of like, put yourself first, like, self-care that just rings really hollow and I think, sometimes can sort of make light of our obligations to one another as people. So I don't know, can you talk about that a little bit? Like, how do we distinguish, like, what's the pop psych talk of, you know like, do what's right for you at all times, which I think is sort of can be antisocial, right? Versus, like, if I don't have a perfect holiday card that I have mailed by December 20th to, my 300 closest friends, which, is an expectation that frankly a lot of my friends seem to have, which I love receiving them. So please keep sending them. If anybody sees this and they want to keep sending them to me, but like, I certainly don't expect it. I do feel like it's unrealistic expectation, right? And so yeah, let's talk about that fine line between selfishness and sort of losing yourself self in a sense of guilt.
Yeah, I mean, I think one of the important things to really think about when you're trying to relinquish guilt is that it might actually be serving you in a number of ways. One is to build connection if there's specific issues that you need to repair or change, but it also finds ways to trick us like, I'm motivating, right? And so if I don't feel guilty because I didn't go to
Hmm.
the gym, for example, then I will probably just never get out of bed again. Like it's either I have the guilt or I just give up. Right? I
Right.
mean,
Yeah,
this
totally.
catastrophic thinking around it,
Yeah.
but guilt is very good at saying, you really need me to motivate you to do the
Hmm.
things that you're supposed to do. And I think, just as all or nothing in anything, all or nothing about body positivity, all or nothing about I need to do everything that I absolutely want. This is certainly not what we're talking about. But let's be honest, women are pretty far down on the other end of that spectrum of like taking
Hmm.
time for themselves. I've had so many women say, my partner or whatever gave me I had a few hours because the kids were off doing something with them, and I didn't even know what to do with myself. Like I
Hmm.
didn't know what was fun for me, I didn't know what was pleasurable for me. And so I think this again, this is an anxious thought that I will become this selfish monster if I start saying, what are the things that actually feed me? What are the things that, are there expectations I'd like to shift because they're making me miserable? What are the things I'm actually doing well I want to pay attention to? And I think so motivation is certainly one that guilt tricks us into. It also can act as a stand in for other emotions because we think we can't feel those, or we've been taught that those are dangerous or not good for women to feel, for example, like taking anger as an example.
Hmm.
Like
Mhm.
someone does
Mhm.
something to hurt you and you feel really angry, but then immediately you say, oh, I shouldn't feel this way because they're X, Y, or Z. They're having a tough
Hmm.
time. They didn't mean it. They still care about me. Like all these different ways that we sort of say, I shouldn't feel that way. And then you go to guilt, it maybe protects you from that feeling of anger or expressing it, but then you don't actually process that true emotion. You're kind of over here with guilt. And that it can do that with happiness too. Like, oh, I feel really excited about this date I went on, but my friend's really lonely and I shouldn't feel so happy. So I should just okay, let
Hmm.
me maybe, modify that. So those are different things where the reason that I think self-compassion, Kristen Neff's work and others is so important is because it's not just self-esteem boosting, like, let me just think about everything good I've done. It's really let me be curious about how I've actually behaved, who I am, what my feelings are, and really treating ourselves with kindness and seeing ourselves as part of this bigger system and sort of mindfulness in what am I experiencing in this moment. But it's not just covering up all the things that are not going that well or things that I've messed up or ways that maybe I've not been the best friend or the best what have you. It's really looking at it clearly and saying, how might I want to make changes here? And
Hmm.
because you're not trying to hide all the negative stuff, it doesn't feel like it's there sneaking out and jumping out at you. But also it feels safe because you're exploring openly and honestly, and your brain isn't going to try to protect you from that. It's maybe going to allow you to learn more about itself. Like what would I actually like to change? I'm still a good person, but how might I like to approach these differences or these changes I'm seeking?
Yeah, that's such a good way of putting it. And what's coming to mind in a lot of my writing about sort of diet culture in healthcare and just in general is that a question I often get is like, isn't it dangerous to sort of accept your body, right? Like, doesn't that mean that you're giving up? Doesn't that mean that you're just descending into like a bag of Doritos? Is kind of like the implication, right? That like
Yeah.
you need that sense of guilt and shame, the guilt shame spectrum, maybe, to sort of keep yourself in check. And I mean, I really reject that. I certainly reject it in my own life that I found periods of guilt and shame way less healthy on so many levels, psychologically healthy, but also physically unhealthy too. And I think yeah, I mean, it sounds like there's so many ways that that applies in so many domains in our lives where we sort of feel like we need this sort of weight on our shoulders of guilt to, like, keep us in check, as you put it,
Right.
right?
Right. Or
Yeah,
even to prove that we care enough. Like if I
yeah,
don't feel guilty when my loved one is struggling, I just don't care. It's like, no, we actually care very, very much. We just don't have to feel guilty because then it becomes like it's our fault in some way, or that, yes, it gives us a sense we can try and fix it, right? There's not the same helplessness if you say it's my fault. You don't maybe feel as helpless, but then you feel guilty. And I think
hmm,
that's a really important point with guilt is sometimes it can be a way to protect us from this feeling of this difficult thing has happened to someone I care about and I had no power over it. And
yeah,
so instead we say, no, you know what? I think I could have done something differently. I'm going to take the blame because maybe that means I can kind of fix it going forward. This sort of belief system that we have that no, we're not that vulnerable. We're not that powerless because loving other people is vulnerable, right? Like having your kid out in the world, leaving your parents and moving on, like just these connections, it's vulnerable. You're vulnerable to loss and to disappointment and grief. And so I think that's sometimes where guilt feels like it's protecting us, but then we don't get a chance to feel those true emotions and they just
mm,
kind of sit there.
yeah, that's really well said. Well, I wanna wrap up shortly, but I wanna ask you a question, that I'm gonna laugh about because, Jennifer, you and I both as physician writers, we have talked, offline about what it feels like medicine, like our whole training is about keeping ourselves sort of at arm's length from our patients, that we don't like to talk about ourselves, and that it can feel vulnerable to talk about ourselves, and, it's very much, like, not the culture of medical training at all, like, you center the patient, so I, of course, need to ask you a question about yourself to end, and I'm curious if you can share an example of toxic guilt in your own life that you have sort of worked through, and, where those feelings came from, how you were able to let them go, yeah, and what a silly question to ask a psychiatrist because you never permanently would be able to do that, right? But, like, what does the work in progress look like for you? And, yeah, how do you think about what's an example of the way that you think about some of these issues in your own life?
Hmm. Yeah, the challenge is choosing which one because there are so many. I mean, let's
Oh
be
my
honest,
gosh, of course. Yeah, of
it's not hard to come up
course.
with
Yeah,
them.
of course.
Maybe one I will choose is that I grew up a long way away from here. I grew up in rural North Dakota, and my parents are still there. And I chose to settle down in New Jersey, outside of Philadelphia. And so guilt has certainly been a part of my relationship with them in this sense of a really good daughter would live nearby. If my mother says, gosh, I wish you lived closer to us. I could do this thing
Yeah.
that my sister gets to do with her own kids, but I don't get to see yours as much. And I've certainly felt that guilt. And I think in thinking about the book and writing the book, I did challenge my own expectations about what does it mean to be a loving and grateful daughter. And also all the things, reminding myself of the things that I am doing, which is connecting with my mom on the phone as much as possible. It's like feeding birds in my backyard so we can chat about the different birds that we're seeing and the Merlin app that we use to listen to them. And sharing stories and sending pictures of the kids and inviting them for different events, going to see them. We went over Thanksgiving in winter in North Dakota. Flying there is a challenge, but we were able to get there and back. So I think it's helped me in saying, what are the expectations I really want to hold? Which I want them to be high in that I want to be loving, I want to be grateful, I want to be respectful, but I don't want to be putting myself in a position where I just constantly feel like I'm not doing enough
Hmm.
because I know that it'll actually cause me to pull away, call less frequently, interact less frequently because I don't want to feel that way. And then that's that vicious cycle. And they're too important to me to do that. So that's one example. Again, there are so many, but I do find every time I would read through the book and be reminded, feel like I wrote it for myself. Okay, these are the different things that could be happening. Let's just check in. Let's really, analyze, let's examine, let's start to make and try some of these different strategies. One of my favorite ones that I talk about in the book is the three good things exercise, which at the end of the day, you're supposed to describe three things that happened that day that went well and then why. And I do that with my family around the dinner table. And it's so great because usually we can get something better than, fine. Like maybe it's what's the best part of your day? Well, lunch was really good. Okay. I mean, that's something. But I think
Totally.
those kinds of exercises, incorporating them has really been helpful in my own life.
Yeah, totally. So I guess what I'm hearing again and again, this is the work of, our psychological lives is sort of being honest with ourselves about what emotions we're experiencing, being honest with ourselves about our expectations and whether or not they're realistic, and sort of teasing out the tension between an expectation that may be foisted upon us from outside sources and sort of our own internal values and what those sort of true realistic expectations are. Yeah. And I guess we have one other question from the group, which I want to try to read. Yeah. So LFH says, Leah says, I really appreciate that framing. If guilt is the gap between expectation and performance, who gets to define the expectation and can we do it in a way that works better for us? And so it's not that we shouldn't have expectations for ourselves, that we shouldn't feel empathy. We shouldn't feel a sense of obligation to our communities, but that sort of really parsing out what are realistic and unrealistic expectations, what are expectations we want to have for ourselves versus expectations that we don't need to have. Yeah.
Absolutely. And like, I would say lastly, like the idea I have with this book, the vision I have with this book, fingers crossed, is that women around the world read it and start talking to each other so that they can really see that these different expectations they're facing, these different challenges, the way they're talking to themselves, like so much of this is almost universal, that they can start pushing back and really be helping each other, like empowering each other and saying, I felt that way too, and I thought I was the only one. And just putting a name to this experience that it is guilt. And how do we start to break that down? I think
Mhm.
that's sort of what I'm really, imagining and so excited about the book finally coming out. You know how long this process can be, because I
Totally.
really want women to talk to each other, not have me be like, this is what you must do, but say, okay, what's worked for you, and how have you approached this, and how would you, think about this situation that I'm in? Because we really can help each other move away from this sense of constant guilt.
I love it. Well, Jennifer, your book is fabulous. I genuinely enjoyed it, and I hope that everybody checks it out. It comes out in January, end of January, wherever you buy books. And thank you so much for joining me in conversation. This is so interesting. There's so much to think about, especially as I contemplate the fact that I'm not going to send out holiday cards. Good riddance. I might send out a digital one. I do like, I mean, yeah, I do like being in touch with people. Relationships are really important to me, but they do not need like a $5 gold embossed card, hand addressed by yours truly, right? They can get an email. So,
Oh my gosh,
uh,
yes, absolutely. Maybe some dancing elves or something. There's so many
totally, we can
options.
animate it. Exactly, we can animate it. Well, thank you so much. This was such a great conversation. Everyone check out Jennifer Reid's book, Guilt Free, available at the end of January. And send us your feedback. If you have any other questions, we're going to post this on Substack. And there are other issues you'd like us to explore, please feel free to reach out. Yeah.
Thank you so
Thanks for
much, Mara,
everything.
for having me. This
Yeah.
was great. Thank you for reading and complimenting the book. Oh my gosh, that is absolutely so wonderful to
Yeah.
hear.
It's really worth reading. All right. Take care. Thanks for joining. Yeah. Bye.